Hello, everybody, and welcome to Irish Hypnotherapy Conference 2025 on our Meet the Speaker series. And here we are talking to Seth Deborah. How are you?
I'm great. How are you doing?
I am very well, thank you. All the way from California.
Yep, all the way from California, Sunday, late afternoon, getting ready to go to work tomorrow. You
Right,
know,
very good. Very good. I'm so delighted that you're coming to speak in Dublin. It's going to be an amazing, we were just talking before, it's going to be an amazing international event, actually, which is great, which is absolutely amazing. You're bringing something particularly, well, actually, yeah, you're bringing something unique to the conference that hasn't been covered before. So, but do you, which is the whole topic of medical hypnosis and pre-surgical hypnosis.
yes, yes, I
But
will.
you're covering that. Do you want to give people just a background to who Seth Deborah Roth is?
Well, I got a long background because I've lived many years. Um, oh gosh, this is going to tell you how old I am. But anyway, I'm proud of how old I am and how healthy I am.
There you go.
Um, I became a nurse in 1969, worked in oncology, and in those days people used to die a lot. So I switched from oncology to the operating room.
Right.
A year's training in a big hospital in New York, and it was a 12-room house, 12 OR, and each OR had a different specialty, and we spent a month in each OR. And then I went to work at a place called Hospital Special Surgery in Manhattan. And from there, I went for training as a nurse anesthetist in Brooklyn.
Okay.
Okay. And was in a very large county hospital. We needed 1,000 cases rather to graduate.
Right.
And I had 3,000 at the end of the first year.
Wow.
So that gives
Busy
you
hospital.
yeah, it was a very busy hospital and I got wonderful exposure experience. And so I'm a nurse anesthetist, and I actually started doing hypnosis when I was in anesthesia training, not knowing that it was hypnosis.
Okay, now you're going to have to explain that one.
It was just Dr. Blumenfeld. She was a wonderful anesthesiologist from Russia who had trained in China. And this is in Brooklyn, and the mafia is real.
Right.
And we had a fellow who had gotten blown up from a garbage pail. When he lifted the lid, it blew open and he had burns on his face. And we were doing a skin graft from his leg to his face. Now, in those days, they didn't have scavenger systems and we were using gases and so
Right.
forth. And so we're putting the mask over his face. And because we couldn't make contact with the face because of the burns, the air was getting into the what he was breathing in. So he wasn't getting all the halothane that he needed. And so Dr. Blumenfeld just started to talk to him in his ear.
Right.
And suddenly he just went, his head just tilted, his tongue came out, and he was zonked.
Right.
And we did a skin graft from his leg to his face with just hypnosis.
So
I
there's the fascination began.
Yeah, I just thought it was Dr. Blumenfeld's way because she had a way of talking to people beforehand and calming them down. And she just had the most wonderful communication with her patients, right? And so I learned from her. I mean, it's not like she instructed me, do this, do that. It's just I modeled what I saw,
Hmm.
and plus my own personality too. And that's how I got involved. Later on, many years later, 1987, I was facing spine fusion, and I started using self-hypnosis,
Right.
and I increased the circulation to my hip where the pain was going down the leg. And I called my husband over. He was a surgeon. I said, Ken, look at this. Look at this. My hip is rising and falling. And anyway, that was 1987. I never had the back surgery. Thank God I never had the back surgery. And that's what really got me into using hypnosis for medical issues.
Brilliant.
And so now I use it I'm still doing sedation anesthesia, but I use it preoperatively for patients. I use it intraoperatively if the local anesthesia isn't working or patients are scared, so forth. And then, of course, I have my private practice too.
Yeah, I was just going to ask, is that in the hospital or in the practice or both?
In the hospital, I'm actually working in a surgery center. You can't use the word hypnosis. They get
Okay.
scared. They get
Okay.
scared liability-wise, blah, blah, blah. You could say guided imagery, guided visualization, but
Right.
God forbid you say hypnosis, right? Um, the nurses say to me, when they call me over, Seth, just do your magic stuff.
I think I've heard Gary Cole say that as well, actually, once or twice. You
Yeah, you're
can't use
relaxed
that word.
stuff, right?
Correct. Yeah, yeah, yeah. It's just a journey in your mind or whatever words he uses. Yeah.
Yeah, yeah. So it's okay. It's okay.
Okay. So is it how widespread is it in the States then the use of pre-surgical mind discussion or whatever name you want to give it?
Not widespread enough. It's definitely not widespread enough. There's Dr. David Spiegel out at Stanford, across the bay from me. I'm in San Francisco area and he's in Palo Alto.
Right.
And he's a psychiatrist. His dad, I think, was Herbert Spiegel. Um, anyway, he has a clinic where they use hypnosis for medical issues, but not necessarily for pre-surgery.
Okay.
Mm. So it's not really commonly used, unfortunately.
Okay.
And
And how effective? I mean, obviously, if the hospital is coming to you to do it, it's effective in the surgery. Otherwise, they wouldn't be doing it.
well, but that they're not coming to me to do it. That's the problem. I just do it without telling people what I'm
Okay.
doing.
Gotcha.
Okay. They're not coming to me to do it. It's not something that the insurance companies cover.
Over. Okay.
Um, I believe for licensed psychologists, they can use hypnosis, and there is a what's called a CPT code where you could bill for it. But most psychologists are not using it really,
Okay.
although it's
Yeah,
more.
because it actually that's the thing. The other thing I remember, depending on which state you're in, depends on whether you can call yourself a hypnotist or a hypnotherapist. There's all kinds of different rules depending on where you are in the US.
Yeah, and here in California, I have to be very, on my website, I have to say that I'm not practicing medicine,
Okay.
not practicing as a nurse. I'm just as a hypnotist.
Gotcha.
I have
Gotcha.
to be very about that.
So, and you have your own practice then as well. And do you deal with issues that might involve surgery at a later stage, even though you're not dealing with the medicine side
I
of it?
deal with everything medical. My new website that's coming up is going to have a specific section for pre-surgery.
Okay.
And under that, another really specific section for total knee and cardiac surgery.
Okay.
Because those are the two surgeries that most people are most fearful about. And post-operatively too, there's a lot of therapy that you have to do for the knee one especially, and that can be painful. For cardiac, you have to change your lifestyle.
Okay.
So, but for
So,
any surgery, they do know that when people are relaxed, they do better. They
yes.
heal faster, they get discharged sooner. They did a study, I think it was Mount Sinai, one of the hospitals in Manhattan, for breast cancer patients, right, who had never been hypnotized before.
Hmm.
And in the induction area, when we start our IVs, they did some quick hypnosis. And those patients got discharged sooner. And each case, I believe, saved about $730 per
I've
case.
seen, yeah, and I've seen research like that, and there's books out like that on that as well that describe the benefits both in terms of the ease of the operation and the recovery time is also a lot quicker. So it's cheaper, it's more effective. And I believe there's hospitals in Belgium now as well that actually do use pre-surgical hypnosis. Yeah,
Yes, I've seen the video. I've seen the
yeah,
video. Yeah.
yeah.
I could tell you as an anesthetist, when my patients go to sleep nervous, they take more medication, and I'm fighting it the whole case, just the whole case long. Whereas, and then they wake up as they go to sleep,
Hmm.
right? Whereas when a person is nice and relaxed, they have a calmer anesthetic experience and they wake up nicer, right?
So how many, if you're in the hospital environment, if you're in the OR, how
Right.
often are you using guided imagery?
Um, for general surgery cases where someone's actually put to sleep, okay,
Right.
not really. We use it in the induction room where we start the IVs, where we interview the patient. Where it has great use is in pain management. One of the places that I worked for 3 years was just pain management. That's all we did. And so they're doing epidurals, nerve blocks, et cetera, which are done just under what they call conscious sedation, a
Yes.
combination of Versed and fentanyl. And it's the perfect place for hypnosis because a lot of people don't want sedation because they want to be able to drive home.
Yes, of course.
And so I've used it there, or they have the local anesthesia, but it's not working well,
Right.
right? And so one of the techniques I like to do is in the pre-op area, do put them into hypnosis, wake them up, put them down, wake them up, put them practice, in and
Yeah.
out, in and out, in and out, telling them. And whenever the nurse at the head of the table touches your right shoulder, you go deeply into hypnosis. And so I trained some of the nurses that during the procedure, even though it was under
Touch the
sedation,
shoulder.
touch the shoulder.
Yeah.
So that's a perfect place for hypnosis.
Perfect. Okay. So what you see then is, if I'm right, what you see is reduced stress for the patient as they go into the operation,
Absolutely.
um, quicker recovery time, but also in terms of reduced pain. And does the less stress improve the healing rates than the speed? Obviously, it does improve the speed of
Absolutely.
recovery.
That they know. I mean, that
Okay.
there are studies on that. Absolutely.
Brilliant. Okay. And that's what you're going to be talking about, isn't that right?
Yes. Yes.
Well, I'm
Yeah.
going to be in the front row listening to this one because this is something that I love to listen to anyway.
Yeah.
Um, so so the whole talk is your conversation literally is about medical and how hypnosis can help in that environment,
Hmm.
pre-surgical. Okay.
Absolutely. Yeah.
It's a
Let's talk
unique,
a little bit about your nervous system, because in order to understand why it works so well, you have to understand the nervous system that we're playing with, so to speak,
okay.
and the parts of the brain that
Yeah.
open up to it, but not a lot because it could be a little boring. I don't.
Okay. And we'd have to be very awake for that one. So we'd have to be going in there focused, going right.
Yeah,
Yeah.
it's not like I want to test people on the nervous system, but it does help because when you start explaining it to your clients and then they understand why this stuff works and
Okay.
they allow it to work better too,
Yeah,
because they.
and actually what you're hitting on is pre-talk in essence, because what you're doing is you're pre-framing stuff for a successful outcome.
Exactly,
Okay.
exactly. Mhm.
Gotcha. Okay. Um, and so, and how long is your own practice in operation?
Officially started 2004.
Well, okay.
Right. I had my physical office until COVID.
Right.
COVID. A little before COVID, actually, wait, my husband died 2017. So I used to share an office with him.
Hmm.
So 2017 is when I finally had to let go of it. It was a
Right.
little much for just a solo person. It was a big office.
Yeah.
Um, and then came COVID, and now it's online. I do go to the hospital for patients,
Yeah.
you know, call me to do that. And if someone lives fairly local, I'll travel
Good
there
for
'cause
them.
I feel
Okay.
like hands-on. Yeah.
Absolutely. And of course, when you're dealing with medical issues too, people can't always drive, which is
Yeah,
it's harder for them to come to you.
exactly. A lot of cancer patients, I will go to their house.
Okay.
But Zoom has really made things very accessible.
Yeah,
Very,
of course. It's wonderful. I'm really looking forward to your talk in Dublin. I really am. I'm looking
oh,
forward because we met in Vegas during the year, and
yes.
now you're coming to Dublin. It's fantastic. And the world is getting smaller and smaller.
Yeah, yeah. I'm very much looking forward to it. I'm looking forward to meeting everybody and all the speakers, all the new people, friends I can make,
Absolutely.
colleagues, and
Absolutely.
spreading the word because medical hypnosis is so unaccepted.
I agree.
You know,
I agree.
when I work in one of the surgery centers, we're doing all these colonoscopies, right? And so I have access to the GI doctors, and there's so many studies about hypnosis and IBS
Of
working,
course. Yeah.
and you still have to fight them to get the referrals. Once you get a good outcome, then they start to give you more referrals. But it's like, I don't know.
That's part of what the conference is about, actually, is trying to get a greater understanding of hypnosis and hypnotherapy to both the general public and to those who, and largely it's the general public because trying to change state stuff takes.
Yeah, yeah. And there's so many medical issues that come from a root cause that
Yes,
hypnotherapy can help to release. Um,
absolutely.
Simple as that,
Yeah, no,
right?
absolutely. And there is all kinds of evidence and research to promote that. Um, and I mean, I work with a little bit of it myself, in terms of say FND, where there is no root cause, or where there's no medication, there's nothing anybody can do. Yet when you clear the trauma, all the symptoms disappear. You know,
Right.
and it's kind of like, okay, but you can medicate for the side effects, i.e., depression, anxiety, whatever. You know,
And just get more side effects from the medication. It's like,
but when we actually clear the trauma, then suddenly everything stops. Whether it's dizzy spells, whether it's can't drive, seizures, whatever, stop.
yeah,
It's very frustrating. You know, I
it was even for me in the medical profession. I had to accept that. It was something that I had to accept, and I got it from my own when I didn't have the back surgery.
mhm.
It was like, oh my gosh. And now I dance, I wear heels. Well, not so much since my knee replacement, but I'm so grateful that I found hypnosis for medical issues for myself, right?
That's brilliant. No, that's brilliant. And that's always the best evidence for why somebody goes into doing something. Because if you know the value of it.
Mhm. Exactly,
Tony
exactly.
Robbins would say, "You have your why."
What was it?
As Tony Robbins would say, if you do anything, you have a why you do it.
Oh,
I love it.
yes.
It's like that magnetic pull that just keeps you going even when times get a
Yeah,
bit tough.
yeah, yeah.
Deborah, thank you so much. I really look forward to seeing you in Dublin.
I look forward to seeing you also and seeing everybody and meeting all the new
Absolutely. It's going to be an
people.
amazing couple of days, and it's just going to be great fun as well. Because that's the thing about conferences. People we meet all friends and we meet friends we haven't met yet.
Mhm. New friends.
Absolutely.
Absolutely. Yeah.
Absolutely. So listen, thank you. We will see you in Dublin on the 5th and 6th of April. And to everyone else, thank you so much for watching. And All the details are on www.irishhypnotherapyconference.ie. Wherever you're watching this, have an absolutely amazing day. Bye.
Bye.